Dear friends, in this video I will be discussing about double row repair of supraspinatus tendon. So what do we mean by double row repair? Double row means this tendon which is torn, it has come out from its original position and it would have retracted behind. We will pull it and reattach it to this part that is called greater tuberosity. When we reattach, we will put anchors. When we put anchors, that a point of attachment is a one row. Normally, if it is a small tear, if it is a very less width of the tear, we pull this tendons, supraspinatus, and reattach it to the tip of the greater tuberosity. If it is a large tear, medium to large tear, then with only one point of attachment might not get complete healing of the. So in such situations, if we feel that this repair will be better for the patient in terms of functional ability, in terms of early healing, in terms of strength, load to failure, means more load has to give for it to fail, then such situations we do something called double row. Double row means one row will be there, the row where it is attached. Before that, one more row near the joint surface. Means if this is a torn area, this is the greater tuberosity, we will repair one row here and one more row anchor will be here. One row here, one row here. So when you are repairing these free ends with the two rows, between one and two rows, the healing happens in that rectangular area between the rows. So we will freshen the ends of the bone surface where this tendon is going to sit, and in that area this healing will happen. So let's say if you have put only one area, one row, there also healing will happen, but the healing happening is at the point of contact. If you have two rows, the healing happen in this rectangular area of the tendon which is attached to the bone. So load to failure means the more load is required, more energy is required for it to get detached from the area. For this purpose, whenever there is large tear, whenever someone is a sports person who will be involved in throwing activities, we will consider double row repair. However, small tears and medium tears, we can just finish with the single row repair. So this is regarding the reattachment of supraspinatus. This is a part of rotator cuff, one of the main tendons which is torn in the rotator cuff tears, and this is very commonly performed surgeries of the arthroscopy of the shoulder. Thank you for watching this video.